Welcome everyone to the Statewide Medicaid Managed Care Managed Medical Assistance Program webinar for Managed Medical Assistance Potential Network Providers. This presentation will teach you about Managed Medical Assistance in the Statewide Medicaid Managed Care Program. To access today's presentation, please visit the link below, acca.myflorida.com/SMMC, and select the News and Events tab under the header image. Note, you can also use the red button to sign up for SMMC program updates via email. Next, please select Event and Training Materials to download the slides from today's presentation. You may also view details regarding future SMMC events by selecting the Calendar of Events and Trainings. Last, choose the files you would like to save. Another note, you may also view files from past events and AHCA guidance statements or submit questions to be answered in future presentations. Now that everyone has had a chance to download today's presentation, let me introduce you to today's presenter. We have Melanie Brown-Wolfter with the Agency for Healthcare Administration. I will now hand you over to Melanie.
Hello. Thank you all very much for joining us. Today's topic is going to be Managed Medical Assistance. We titled this a 101 so that you all would understand or just get a basic understanding of what the agency is moving to in terms of managed care. Most of you are familiar that we operate several systems today, our fee-for-service system, the Medipass system, and then and other aspects of managed care. And we've just completed a procurement, and so we're moving forward with our Medicaid program being almost exclusively providing services through managed care. Our first slide here talks about what is the definition of managed care, and it's when healthcare organizations manage how their enrollees receive healthcare services. The managed care organizations will work with different providers to offer quality healthcare services. They also work to make sure that enrollees have access to all needed doctors and other healthcare providers for covered services. And people enrolled in managed care receive their services from providers that have a contract with the managed care plan. So rather than Medicaid providers applying to become a Medicaid provider or a provider in the community wanting to become a Medicaid provider, you can still do that, but you also will have to enroll or contract with the managed care plan in order to be able to serve a majority of the recipient. And again, folks are asking us, why are we making these changes? And because of the Statewide Medicaid Managed Care, or SMMC program, the agency is changing how the majority of individuals receive most health care services from Medicaid. And many of you are familiar with these two components of our program. One is the long-term care program, which implementation began in August of 2013 and will continue through March of this year. And then we'll begin implementation of our MMA program, which will begin in May and conclude in August of this year. Now, the SMMC program does not limit medically necessary services. The program is not linked to changes in the Medicare program and does not change Medicare benefits or choices. The program is not linked to the National Health Care Reform or the Affordable Care Act that was passed by the U.S. Congress. It does not contain mandates for individuals to purchase insurance, nor does it contain mandates for employers to purchase insurance. And it does not expand Medicaid coverage or cost the state or federal government any additional money. Now, when we talk about enrollment in managed care, today we have populations that are mandatory for managed care, those who are excluded and cannot enroll in a plan, and those who are voluntary can choose a managed care plan if they wish. The legislation that implemented the SMMC program changed a bit some of the requirements for those folks who are mandatory for managed care and those who will not participate. And so the following groups are going to be excluded from enrolling in a managed care plan. And those are individuals that are eligible for emergency services only due to immigration status, and that's because they are a short-term enrollee in Medicaid, and they also have a very limited benefit packages. They're really only eligible for emergency services only, so they're not going to be eligible for managed care. Individuals that are eligible for managed care through family planning waiver, and again, they have a smaller service package because their services are limited to those services around family planning. Individuals who are eligible as women with breast or cervical cancer. Again, these individuals are time limited into Medicaid for the most part because of their eligibility. and children receiving services in a prescribed pediatric extended care facility, or PPEC, and that is in statute that those children will be excluded from enrollment in managed care. Now, who may participate? These are the individuals who may choose to enroll in a managed care plan or may choose to stay in fee-for-service. These are individuals who have other credible health care coverage, excluding Medicare. These are like TRICARE or some of the other large insurance medical coverage. Individuals who are age 65 and over and reside in a mental health treatment facility that meet the Medicare conditions of participation for a hospital or nursing facility. Individuals who are in an intermediate care facility for individuals with intellectual disabilities, an ICF-ID. And individuals with developmental disabilities enrolled in the home and community-based waiver pursuant to state law and Medicaid recipients. So these are the groups that are volunteered to participate in a managed care plan. Now, some of you will be very interested in what the service package is going to be. This slide describes to you the minimum required covered services for all of the MMA plans. And so these, if you will look at these, they are our state plan covered services, and so all plans must cover at least state plan level of service. And they may offer beyond that if they have negotiated it, but they have to offer at least the minimum of state plan. And so you'll see the list that's here. Now, in addition to the state plan covered services, in our negotiation process, we were able to successfully negotiate with the plans who awarded a bid for expanded benefits. This slide is a description of the additional services that are beyond state plan level of coverage or not covered under state plan that will now be available to individuals who choose to enroll in these particular managed care plans. And so the list is here, and you can see adult hearing, dental, art therapy, the pneumonia vaccines, pet therapy. These are all services that are not going to be available to Medicaid recipients who will be enrolled in these managed care plans. Another question that we get frequently is where will recipients receive these services? We have several types of health plans that will offer services through the MMA program, including our standard plans, specialty plans, comprehensive plans, and Children's Medical Services Network. Health plans were selected through a competitive bid in each of the 11 regions of the state. Again, as we move forward, our standard plans are both HMO, or Health Maintenance Organizations, and Provider Service Networks, or PSNs. An HMO is an entity that's licensed under Chapter 641 of Florida statute, and they are we contract with the HMOs on a capitation basis so that there is a monthly payment on behalf of each member to the HMO, and then the HMO is responsible to provide all services and to make sure that there's access for all Medicaid state plan services and that they have a complete network of providers. And this requirement also applies to the PSNs. But a PSN is a network of established, that's organized and operated by a healthcare provider or group of affiliated healthcare providers, which provides a substantial portion of the healthcare items and services under a contract directly through the provider or group of affiliated providers. So in other words, they're not licensed under Chapter 641, but they are owned and operated by a provider organization. Now, in terms of non-standard health plans, we have our specialty plans, we have comprehensive plans, and we have the Children's Medical Services Network. A specialty plan is a managed care plan that serves Medicaid recipients who meet specified criteria based on age, medical condition, or diagnosis. The example specialty plans will be on the next slide, but we talk about an HIV/AIDS plan, severe and persistently mentally ill plan, and then we have several other plans based on medical conditions like COPD or congestive heart failure and that sort of thing. We also have what we call comprehensive plans, and these are managed care plans that will offer both long-term care and acute care services. And of the 7 long-term care plans, 6 of them are going to be comprehensive in various regions throughout the state, and so recipients will be able to enroll in one plan if they're eligible for long-term care and receive their long-term care services and their MMA services from one provider. The Children's Medical Services Network is a statewide managed care plan for children with special health care needs. This is, it operates today, and so it will continue under statute to operate under a contracting arrangement with the agency. So CMS Network will continue statewide. You've noticed earlier in the slide we've talked about regions under the SMMC program. Currently we have Medicaid areas, and there are 11 areas in the state. The regions correspond to those 11 areas, and so the new buzzword that you'll be hearing is all regions. And so this is a map that depicts by geography where each of the regions are. So most of you will most likely be familiar with this. In terms of implementing our MMA program, we've selected 14 companies to serve as general, non-specialty MMA plans. 5 different companies were selected to provide specialty plans that will serve populations with a distinct diagnosis or chronic conditions. These plans are tailored to meet the specific needs of the specialty population. In other words, they offer additional services and benefits targeted to the particular populations to serve their needs. The selected health plans are contracted with the agency to provide services for 5 years. So for the next 5 years, this is going to be the marketplace, and these will be the plans that will be available as choices and as for providers to contract with to provide services. This slide depicts by region the plans that have been selected and that will be available in each region as a plan choice. If you look to the far left column where it says regions, you just go down from 1 to 11, and then as you go across, you'll see the names of each of the health plans, and we have an X in the box of the regions that are that they will serve. For example, the first plan is AmeriGroup. They'll be available in regions 5, 6, 7, and 11. And then if you go across the board, Sunshine State is available in almost every region except 1 and 2. Preferred is available in region 11. So you can see from that where the plans are. Now, in terms of our specialty plans, this slide will depict where the specialty plans are going to be available to serve recipients by region. Again, the region is on the far left column, the first column that's there, and then as you go across from left to right, you'll see the name of each of the plans that are available, and then you can see the regions will serve members. Okay, another question that we get frequently is what providers will be included in the MMA plans. Now, please note that all plans must have a sufficient provider network to serve the needs of their plan enrollees as determined by the state. Managed medical assistance plans may limit the providers in their networks based on credentials, quality indicators, and price, but they must include the following statewide essential providers. The statewide essential providers are the faculty plans of Florida medical schools, the regional perinatal intensive care centers, or RIPICs, specialty children's hospitals, and healthcare providers serving medically complex children as determined by the state. And what this means is that every plan in each region of the state must contract with these organizations because they have been described in statute as being a statewide essential provider. This is mainly to make sure that there's access to critical medical services for particular individuals. And so that, especially with an example is especially children's hospitals, often recipients will have to travel to receive specific services that can only be offered from a specialty hospital. And so with each of the plans in all regions contracting with this, then that will make those services available. This is the slide indicates that it's the proposed implementation schedule. On December 23rd, we received approval from federal CMS for our implementation plan. Including in that plan was our implementation schedule. So this is a final, it is approved, and when we post the slides to the web, you'll see that it is the final schedule. The first regions to go live are 2, 3, and 4, and the first date of enrollment will be May 1st. Regions 2, 3, and 4 are the areas basically from Tallahassee to Jacksonville and down in Volusia County there. The next regions to go live will be areas 5, 6, and 8, and that is the Tampa-St. Pete area and Collier County along the west coast, and that will be June 1st, followed by regions 10 and 11, which are Broward and Dade counties, and Monroe, and that will be on July 1st. And then finally, we'll roll out regions 1, 7, and 9, region 1 being the Pensacola area, 7 being the Orlando area, and 9 being down around Palm Beach. And those will go live August the 1st. So even though the slide says that we're subject to federal approval, we have obtained federal approval, and this is the final rollout schedule. Now, along with rolling out Obviously, we want our recipients to know and be able to make an intelligent plan choice and a choice of plans that will best meet their needs. So approximately 60 days prior to each region start date, eligible Medicaid recipients will receive a letter with enrollment information, including information on how to enroll in the plan. Eligible recipients who must enroll, these are the ones who are mandatory for managed care, will have a minimum of 30 days from the date they receive their welcome letter to choose from the plans that are available in their region. So they'll get a notice at least 60 days in advance, and they will have at least 30 days to make a choice. In addition to that, we've already sent a pre-welcome letter out this month for recipients in regions 2, 3, and 4 that are just a general letter that says, "Welcome to SMMC. Please look for additional information to come through the mail for you to be able to select a plan." So that there will actually be about 3 notices that go out to our recipients to let them know and to provide information on the plans that are available in their region. After joining a plan, recipients will have 90 days to choose a different plan in their region. So in addition to the notice period prior to having to choose, once the recipient gets in, they do have 90 days to be enrolled in the plan, access services, and determine if they want to stay in the plan or not. They can choose a different plan without good cause. After 90 days, the recipients will be locked in, and they cannot change plans without a state-approved good cause reason or until their annual open enrollment period. So they will be locked in until the open enrollment period comes up, and again, after the initial 90 days of enrollment. Choice counselors are available to assist recipients in selecting a plan that best meets their needs. This assistance will be provided by phone. However, in-person visits are also available for recipients by request, and the information will be available online. And so the website that's indicated here on the second bullet will give recipients information, and providers and can access it as well. It's open to anyone. It will give you information about the plans that are available. And that website address is www.fl.medicaidmanagedcare, all one word, .com. So please note that this information is available now. Again, we're going to send out information through the mail to recipients on multiple occasions. Recipients can also call to speak to someone, so there will be multiple ways for recipients to receive this information. Many people have questions about the process for enrolling in a health plan, and we sort of touched on that with the last few slides. But we do encourage our recipients to work with a choice counselor to choose the managed care plan that best meets their needs. And so when we walk through the process, you'll see the bullets here. Recipients have 30 days to enroll in the plan. And when their information goes out, they have 90 days afterwards to change plans if they desire. After 90 days, enrollees must stay in their plan for the remainder of the 12-month period before changing plans again. But know that recipients may change plans before the remainder of the 12-month lock-in period ends, but only if they meet certain criteria, or they have the criteria being the good cause reasons for disenrollment. Now, enrollees can change their providers within their plan at any time. So one of the things is we encourage all recipients to choose a primary care provider. They may choose to have a different primary care provider as many times as they wish and as often as they wish. There's no limit on being able to change. They also may request to change other types of providers in the plan as well. But selecting a plan can only happen at certain periods during the eligibility year. One thing I do want to say about open enrollment is that once we go through the implementation, a recipient's open enrollment period will be reset to the date that they to their region went live, but this will not change their Medicaid redetermination date, which is the date that they have to be recertified as still being eligible for Medicaid. So the open enrollment date will reset with our MMA implementation, but the Medicaid redetermination date or eligibility date will not reset. Moving on, we are very concerned about continuity of care, and we want to ensure that as we roll this program out, that Medicaid recipients continue to receive the services they are receiving at the time of implementation. So all of our MMA plans and our long-term care plans are required to authorize and pay for existing services for up to 60 days after the transition, or until the enrollee's primary care practitioner or behavioral health provider reviews the enrollee's treatment plan. This is very important to us, and so we want both providers, plans, and recipients to understand that current authorized services will continue for up to 60 days after enrollment in the new MMA plan, or until the enrollee's treatment plan has been reviewed and updated. Now, as we roll out this, many of you will realize, too, that there will be certain programs that are going to be discontinued. And some of the programs that were previously part of Medicaid are not going to continue. By statute, the following programs will sunset, and that is MetaPass, or our primary care case management program, the prepaid mental health program, or PMHP, and the prepaid dental health plans, or PDHP, are currently scheduled to sunset statewide. Other components of MMA are our physician pay increase mandate. Managed care plans are expected to coordinate care, manage chronic disease, and prevent the need for more costly services. This efficiency will allow plans to redirect resources and increase compensations for physicians. And so in statute, that plans will achieve this performance standard when physician payment fees rates equal or exceed the Medicare rates for similar services. And again, the statute is noted here. This is a requirement. The agency may impose fines or other sanctions, including liquidated damages, on a plan that fails to meet this performance standard after 2 years of continuous operation. The agency will be monitoring this very closely. This is an expectation of the plan. It's also in statute and in contract, and so we will be able to see that plans will be able to increase our physician rates. Another component of MMA is the Achieve Savings Rebate. And this is a program that's established to allow for income sharing between the health plan and the state, and it's calculated by applying the following income sharing ratios. And there are 3 bullets here. 100% of income up to and including 5% of revenue shall be retained by the plan. Additionally, 50% of income that's above 5% and up to 10% shall be retained by the plan, and the other 50% refunded to the state. And 100% of income above 10% of revenue shall be refunded to the state. And this is to allow the state to be able to share in the savings that are generated by moving to a managed care model. Incentives are included for plans that exceed agency-defined quality measures. Plans that exceed such measures during a reporting period may retain an additional 1% of revenue. And this is to ensure that managed care plans are not just cutting services to generate revenue, but that the quality measures are being met so that we can see there are quality outcomes, and we can see that it's demonstrated that the services are being provided and that quality of care is high and that recipients are receiving the care that they need. Another component of the MMA program is the low-income pool, also known as LIP. The LIP program was initially implemented on July 1, 2006. The LIP program currently consists of an annual allotment of $1 billion, funded primarily by intergovernmental transfers from local governments and that are matched by federal funds. Payments are made to qualifying provider access systems, including hospitals, federally qualified health centers, and county health departments working with community partners. The objective of the LIP program is to ensure support for the provision of health care services to Medicaid, underinsured, and uninsured populations. We are in active negotiations with federal CMS on our LIP program. It is a part of the waiver, and it will continue as currently approved. Now, moving forward operationally, we are working to create some administrative efficiencies and to run our Medicaid program more efficiently and better. And so we are centralizing our complaint system. And so we want to know if you're having a problem as we implement the program and as we move forward. And so on our website, and you can see the website there is highlighted in yellow on the left-hand side, and also there's a blue button on the right-hand side. So if you're having a complaint, or have a problem, if you'll go online, click the Report a Complaint button, and then the form pops up here left, and if you will complete that, all complaints will go to a centralized area. We have staff dedicated to work the complaints and to get back with you. So if you will put your name and contact information in there, you will get a personalized response back from agency staff. If it's something that you don't want to put your name on, you can still submit it anyway. We just won't be able to contact you, to help resolve the problem or to let you know that the problem is resolved. And you can see the website is listed at the bottom for the Medicaid area offices as well. So this is the centralized reporting system. We encourage you to use it to let us know what's going on so that we can work to make the program better and to resolve any issues. This is our resource page here, and so we just want you to know that questions about SMMC, either the long-term care component or the MMA component, can be emailed to the email address here. It's the first bullet, which is FL Medicaid Managed Care, all one word, at AHCA.myflorida.com. And updates about our statewide Medicaid Managed Care program are posted online at this website as well, which is the AHCA.myflorida.com/SMMC program. If you look on the screen too, the pink button on the right-hand side that says Program Updates, you can sign up for our mailing list, and we will automatically email you as updates are available. And so that sort of saves you from having to go to the website every day and look to see if there's anything new that's been posted. We will email you when that occurs. So additional information can be found on YouTube, Facebook, and Twitter. And so additional information we found at each of these sites if you would like. So at this point, I'll turn it back over to Jessica.
I would like to remind you to send any questions that you may have to FL Medicaid Managed Care at AHCA.myflorida.com. Again, that's FL Medicaid Managed Care at AHCA.myflorida.com. Thank you for participating in today's presentation, and have a great day.